Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we'll be focusing on 10. What does 10 stand for? 10 stands for the toxic, epidermal, necrolysis. So here the body surface area is going to be greater than 30%. So far the conditions we discussed, this is maximum. So we discussed the erythema multiforme major and the Stevens-Johnson syndrome, it is less than 10%, whereas the TEN, it amounts to greater than 30%. Next, what are the causes? The causes, this is again, it is nothing but it is drug induced. That is, it includes the cephalosporins, CS, then it includes the sulfa drugs, as well as allopurinol. Then looking at the associated symptoms, it includes the fever, malaise and the headache. Now let's look at some mucosal lesions. So talking about the mucosal lesions, it is severe mucosal lesions are seen. So what about the basic lesions? Lesions is, it includes, there's a diffuse generalized epidermal detachment. There's a diffused generalized epithelial detachment, epidermal detachment. There are 10 with spots. They are widespread pruritic macules and the flat atypical target lesions. So they are pruritic macules and plus flat atypical target lesions. Next, the 10 can be without spots. So there's a loss of a large epidermal sheets without the pruritic macules. So there's loss of epidermal sheets. So this is without the pruritic macules or the target lesions. And here it is going to be again the Nikolsky positive. Nikolsky sign, it is going to be positive. So how is the distribution in this case? The distribution in TEN is going to be extensive. And what about the histopath? The histopath is going to be, there is epidermal necrosis. And there is a dermoepidermal suppression. There is also a minimal dermal inflammatory cell infiltrate. Next, there are also large areas of epidermal detachment. Next, let's move on to the recurrence. So what about the recurrence? So talking about the recurrence, it is uncommon and drug related. And talking about the mortality, it is going to have a very high mortality. And compared to the other characteristics such as the erythema multiforme major and the Stevens-Johnson syndrome, toxic epidermonecrolysis, aka the Lyell syndrome. So this is the highest mortality. Channel.